Well, hi, Phil. I'm so glad you're here with us today.
I'm glad to be here.
This is Phil Johnson. He's with the University of Arizona, and he's the, oh dear, I'm going to get it wrong again, the assistant professor of practice with the University of Arizona, and he's doing research and studying relaxation techniques. Do you want to tell us a little about yourself?
Sure. Yes, I'm an assistant professor of practice in the counseling program, and I'm a rehabilitation counselor. So I've been working with people with disabilities for years and years and years. And I've only been here for about 4.5 years. So I've been practicing up until then. I've been using relaxation training for about 20 years. I think I was trained about 20 years ago. And it's kind of interesting. I was working with people with intellectual disabilities, developmental disabilities, and pretty severe disabilities. And the person that trained me, they had very serious behavior problems. And we were able to help people get off medication. So basically, we were training people to relax themselves so that they could control the anxiety or the tension or the stress or whatever that was leading to their, shall I say, blow-ups. Because we were working with some pretty tough people. But in the process of this, I'd noticed so I'd be working with a person with autism. They might have a stereotypic movement disorder, or there might be dyskinetic movements that were caused by medications. And I would notice that when they were relaxed, everything would stop. I mean, all the movements would stop. And so it kind of got me to thinking that had been interested in tardive dyskinesia, which is a movement disorder caused by antipsychotic medications. And so I did a little study. It was actually my dissertation research, and just to show that I could, that the movements would stop during a clinical setting when a person was relaxed. I mean, I'd done this so many times that it was just kind of a nice way to put it together and demonstrate that and for a research project.
Wow.
And so then after I graduated, I was a practicing counselor for a while and for a number of years, and I had continued to use relaxation training. And then lo and behold, somebody came along and they knew about the work that I'd done before with tardive dyskinesia. And they said, well, I have this person with Parkinson's disease. Would you be willing to try this out? And she freezes. She has problems with freezing. And I said, well, sure, of course. And so that's what got me into doing this. So just kind of a happenstance thing. And since then, I've learned that there's a body of research on relaxation training and biofeedback and things like that for movement disorders. But what I'm doing is just a little bit different from the things that I've read about.
Wow. I mean, I knew you were doing relaxation. I had no idea about all of that and the tardive dyskinesia. So does this also, then it would make me think that it would also potentially help restless legs.
Well, it's worth a shot.
Yeah, I mean, you're right. It'd be worth looking at. So many people with Parkinson's have restless legs.
And that's certainly also can be induced by antipsychotic medication. So there are all these things that seem to work together. So sort of parsing out which is which is, so there's tardive akathisia that can be caused by these medications. And so, I mean,
wow.
So many of the people that I've worked with had certainly experienced all of those things.
Well, and what a wonderful thing. I mean, certainly there's no cure for Parkinson's or Huntington's or any of the diseases that we're talking about, so many of these movement disorders. And so we rely on, pharmaceuticals, which is great. I mean, we need to have treatments, but then they come with their own, set of side effects. And so Absolutely. What an incredible opportunity and ability to give people back control with what you're teaching too.
Well, the nice thing is that it doesn't involve medication and there are really no side effects. And
right.
A further benefit is that as I'd been working with people with Parkinson's disease, I found out about the other symptoms of Parkinson's disease, such as depression and anxiety. And I was working with one gentleman who had a tremor pretty much in his left arm, and he was more concerned about anxiety than he was about the tremor. So, and relaxation therapy has been used for years and years and years to treat anxiety. And so this was kind of a perfect. So he was having several anxiety episodes a day during the week before we actually started to implement it's a cue control procedure, so a person can actually relax himself when they need to relax themselves. So they use a cue word to do that. So it's a self-cueing thing.
Okay.
That's part of the therapy, and that's what's a little bit different from the other relaxation therapy approaches that I've read about. But anyway, so he was having multiple every day, and for about a 9-week period, he had one episode of anxiety, which was not as intense and was not as long in duration. So that was kind of so that was a nice thing to find out, that that this will address multiple problems that a person with Parkinson's disease might be experiencing. And then, of course, there are also the feelings of, I mean, people can be depressed because they have a neurological disorder. And certainly that would be perfectly normal for a person to experience that, and this can be helpful for that as well. So it addresses movement disorder.
Right. I mean, the whole, it's interesting, the anxiety piece. I want to say the statistic I've read is somewhere around 80% of people with Parkinson's have pretty severe anxiety and depression, and there really is no treatment for that. So, wow, that's like giving your life back. I mean, it's debilitating.
Well, it's interesting. This gentleman that I'm talking about, his doctor had given him a medication, and he tried it once and didn't like it. So I thought, well, this is the time we really need to step up what we're doing. And it was right after that I taught him how to just relax himself when he needed to do so. And then, as I say, there were 9 weeks. And I still see him. I think he may have had a couple since then, but again, not as long in duration and not as intense. And he was having multiple episodes of anxiety per day. One, I think he said, lasted about 4 hours. So it's very serious concern.
Right. So tell me a little bit about, tell me a little bit about what you've been, the practice you've developed.
Well, I've actually was taught to me by John Ferreira, the relaxation technique, and it's a bit different from traditional relaxation techniques. So there are several. There's the traditional progressive relaxation technique where the trainer instructs the trainee to tense and relax muscles, and then to concentrate on what it feels like to have between tense and relaxed muscles. There's something developed by Poppin called behavioral relaxation training, and that involves instruction of what relaxed posture looks like, and then feedback, and then some modeling. And this is, the best way I can describe it is that it's a guided relaxation. And I think that John came up with this because he was working with people with intellectual disabilities who would have a hard time being able to tense and relax their muscles. And so he talks through the different muscle groups and asks people to think about relaxing them, and basically starting with the hands. Progressive means going through the different muscle groups in the body. So starting with the hands, going to the arms, and then eventually ending with the feet. And then modeling that at the same time. And we've been playing an ocean surf sound in the background. So it's a sort of monotonous sound that is conducive to relaxation.
Right.
And we also pace the script with that, with the ocean surf sound. And so that's the technique for learning to relax. And then after, and then we assess this. So we have a scale. And so once a person is able to achieve a score of at least 90% or better across 2 or 3 consecutive sessions, then we'll introduce the cue, which we've been doing all along, which is just the word relax. So we say the word relax repeatedly throughout the session. But at this point, then we say, when you tell yourself to relax, this is how you'll feel. And so it pairs the word relax with the feeling of being relaxed, so that eventually the word relax has the potential to become a cue to become relaxed. And that's called cue-controlled relaxation training. That's been around for years too. Certainly nothing that that either of us invented. But it's, I haven't seen any research that actually uses that for working with people with movement disorders. And so that's so that enables us to transfer that very quickly. So this fellow that I was telling you about with the anxiety would experience it when he would go to the gym. He would start lifting weights. And so when he felt this happening, he would take several deep breaths and cue himself to relax, and it would go away. So it would never become a full-blown anxiety attack. He was also having trouble with brushing his teeth. He's left-handed, and the tremor made that difficult. So we worked on that, and he was able to control the tremor at least long enough to brush his teeth. And the other thing, as I said, during the relaxation session, there's almost no movement. And actually, I mean, that fits, because it makes sense. It's because when a person is relaxed, usually the movements decrease in severity. If a person is anxious, then they increase in severity. And so many of these movements are also absent during sleep.
Right.
And so it just, so I just thought this would be a good thing to try. And then I found out that other people had done it, but then the way they'd done it was a little bit different.
Right, right. Yeah, because you're pairing a couple things together so that there's the experience plus the training. And then I'm also aware of the body awareness that comes through this, which is
absolutely
powerful.
And then basically people can turn this on when they need to.
Right.
So that's
and that just is such a gift, because there's just so little control you have when you have a movement disorder. Everything is out of your control, and to give some cue that you can have self-directed and make your, be in control of that. That's powerful on many levels, I think.
Well, and as you say, there's no cure for Parkinson's disease. And so the least we can do is alleviate. So it at least addresses that. And I've told several people that I've worked with, if you're just really having a bad day and the cue isn't working, I give people a CD of the session to work with, so that they can, basically I'm out of their lives after a while, so they can do this on their own. So I say, if you're having a really bad day, just go into your room, lay down, put the CD on, or put it on your iPod and listen to it that way. And you at least have 25 minutes of respite.
Right.
But there, another fellow I've been working with, the first time I worked with him, he said, well, geez, it felt like I didn't have Parkinson's disease. And occasionally people will say that they feel like they're floating, which means that they're completely relaxed. So it's just a very interesting phenomenon, I guess, to observe this. But
right. Do the care partners participate in this too? I'm thinking this could be powerful for the care partners.
Well, yes, with the couple I mentioned to you earlier, absolutely they do.
That's cool. And then what a nice thing to share together too.
Yes.
There's just so many ways that I could see this being an incredible resource for people. And it's also a really good reminder about how you kind of get back in your body, even though I think sometimes with the movement disorder, we're so anxious to get out of the body.
Yes.
Because we feel comfortable in it. So it's a good, safe way to return to your body.
Yes.
Mhm.
I mean, people,
How do people go about contacting?
well,
Oh, I'm
you know,
sorry. Say it again.
that's okay. You're breaking up as well. I'm just getting started with this. So I'm working with a few people, but I just think before I roll it out, I mean, I know this works, but before I roll it out, I think I need a few more people under my belt. And right now I'm working with about 4 or 5, and I'm going to start working with a person with essential tremor next week, which will be a challenge because he's a painter. And so the fine motor movement is going to be a real test, I think,
Right.
just to see how much he'll be able to control that.
Right.
But for now, it's just been word of mouth. So
Okay.
I expect in a couple of months that I'll really roll this out, and then I'll be more available to people.
Sure. Well, once we're done, I'll get all of your contact information, or the information at least we can put about you on this video, and we'll end the video with that.
Well, thank you. And I have a new email account, so I'll give you that. So
Okay, wonderful. Well, I'm so grateful that you took time to talk with us today and to share this information. I think it's a great reminder of a tool that doesn't cost money after you learn it. And once you learn it, it's something that is yours to keep.
Yes, and I should also say that I'm starting to work with some physical therapists that are focused on working with people with freezing problems, and so putting this together with. So I think that's a really good thing, being able to work with people's physicians and with physical therapists or trainers. I think it's very valuable to try and do that, to integrate this with everything else that a person is doing.
Absolutely.
It doesn't work in isolation. It's very helpful to integrate it.
Yeah. Oh, that's wonderful. Well, we'll help you get the word out, because I think it's a great tool, but it's especially helpful because you understand movement disorders. So while relaxation is great, to understand movement disorders with that is it's a great pairing. So, well, thank you.
Besides that, they're the emotional or the mood disorders that accompany. So
yeah,
it addresses all of that.
That's fantastic. Well, thank you so much for taking the time today.
You're welcome. Thank you, Sarah.